approval of the minutes. They've been emailed out to you. I believe you have a hard copy in front of you as well. You should have had a chance to read over them. Are there any objections or corrections to the minutes? Seeing none, I will ask for a vote of acclamation for approval of the minutes. All those in favor say aye.
Aye.
Opposed, no. Minutes are approved. Next item on the agenda is the Child Care Capacity Accelerator grants. I'll turn that over to Melissa.
Thank you and welcome everyone. It's nice to see you. Lindsay asked me to do just a little bit of microphone etiquette to enhance the sound for the folks watching online. We ask that you keep them muted unless you are choosing to talk, and then it's just there is a nicely labeled on-off button, and this red light will go on when it's active. So with that, let's talk about the Child Care Capacity Accelerator grants. We gave these grant awards earlier this summer at the special meeting, June 23rd. This cabinet approved $43.5 million worth of awards that were given to a series of communities across the state to build new capacity, to physically build spaces, the buildings, and major renovation of locations where childcare is needed across the state. We worked very hard on that process to ensure that we had as much geographic reach as possible. We braided together 4 sources of funding. Lindsay, I think there's a slide that should be up. Thank you. We blended together 4 sources of funding that totaled the $43.5 million. $20 million of it came from the state fiscal recovery fund dollars that the American Rescue Plan allocated to every state. So we got $20 million of what we call in Kansas Spark funding, with thanks to the legislature for approving that. And then DCF transferred $20 million from their child care development block grant funding, American Rescue Plan discretionary dollars that gave us operational funding. So the $20 million in Spark was allowable use for construction. The CCDF ARPA was the operations startup costs. We were gifted $2.5 million from the Patterson Family Foundation to put to use in rural communities, and also was allowed to be used for construction. And then our preschool development grant, we managed to reallocate $1 million of the grant with approval from the federal project officer to create innovation community funding. And so that was all done, and all but one are successfully set up. I do want to share that one of the programs that we granted construction funding to declined the award because we had reduced the amount requested, and they met as a board, and as appreciative as they were of the grant award that we approved, they felt like the fundraising they would need was something that in the timeline the funding has to be spent would be very difficult. So they voted to give back the award. So that brings us to today. DCF saw the incredible demand that was expressed through the RFP and the number of applications that we received, and they worked with us. Go back one, Lindsay. They worked with us to provide another $11 million of funding from the same source, the CCDF ARPA discretionary funds. So again, these are grants that are for operations of child care facilities across the state. They cannot be used for major construction. We are presenting a slate, and I'm going to introduce Hannah White from our team in just a moment to walk you through the package that we're proposing. And I'll pause here and just say that in June, when we presented the Child Care Capacity Accelerator, Lucas Neese was a member of our team and had helped us stand up the RFP and guided us through the application and review process and worked with all the technical assistance questions and all of that. He was a valued member of our team. However, Lucas in August took a job with the city of Ottawa. The city can pay much more than the state can, so this was a nice move for his family. We reorganized our roles and responsibilities internally, and Hannah has transitioned from being our workforce coordinator because the projects that she was managing they're pretty far along and in good hands with the KU side of things is supporting us, and we've got project management on the workforce registry. So Hannah stepped in to the role of our federal project coordinator. We're very pleased. She's been with us for 3 years, and it's nice to see the growth, and we appreciate her ability to track lots and lots of details. So I'm going to bring Hannah up. If you would take a seat at the presentation table, and we can walk through the priorities of the program and the slate that we're wanting you to consider today.
Thank you so much, Melissa, Mr. Chair, and the board. So as you can see, we have a total of $11 million to allocate in addition to the remaining Spark, which was $425,000. The process that we undertook was initially notifying all accelerator grantees, whether they were awarded in the first round or not. We notified all accelerator applicants. The 7th is when the funding was made available to the Children's Cabinet, and by the 13th, we had sent out that invitation to all of those applicants, notifying them about the opportunity. We did elucidate that the requirements were the exact same, so it had to be operations only, had to be building capacity. The emphasis again was birth to 5, early childhood, and year-round care, so very important requirements. Our deadline to submit those updated and abbreviated applications was the 25th of September, and then the week following, our internal team worked very diligently to review all of those applications. We had 37 in total. Of that, 18 were previous applications. From there, we pulled applications that didn't meet the initial requirements. So if they weren't adding capacity, regardless of whether they were funded previously or not, if they didn't have an emphasis on birth to 5, they were excluded. Or if they were not able to really evidence that they could feasibly spend the operations funding by 6/30 of '24. So those are really the big factors that knocked out some of the applicants. From there, and I would like to highlight that in total we had $16.6 million requested, but we also had $8.9 million in community match, which is really impressive and speaks to the nature of our applicants and the appetite for these types of projects in the child care workforce. And just as a reminder, that spending deadline is 6/30 of '24, and that became a barrier for some of our applicants as we went through. Lindsay, go ahead. So just to kind of orient you to this, the dark blue would be applicants who had already been funded with Child Care Accelerator funds in the original round. And then we also specified how much funding on this table. Our green applicants are totally new grantees for us, so really excited about some projects that maybe weren't quite there in the first round, and they had the time to collaborate a little bit more in their communities, find additional funding, find that match, kind of strengthen their projects and come back with a better application. So I'm really excited about a few of these because that's the type of project that they were. They took the correction and they ran with it. So just to highlight for you a couple of these projects that we're excited about, you can see in the artifact that we provided a full kind of overview of each project independently. But two on this slide that we're excited about is Alfred Kids Academy, that's in Wichita, Kansas. So in addition to adding 7 infant slots, which we know is very difficult, much needed across the state, they also offer non-traditional hours. And so from an equity lens, we love that. They're going to be working from 6 a.m. to 10 p.m., which is certainly needed in the Sedgwick County area. Additionally, E9 Properties, which the center that was granted is Little's Learning, that's out of Benton, Butler County. Across 5 6 locations, E9 Properties, with this operations funding, is able to commit all of those locations to year-round care. So they are able, so when we talk about capacity, certainly there's the initial capacity that we're getting from these funds of 32 spots, but in addition, 6 programs are going to commit to year-round care, full-time spots. So really pretty incredible. Also, E9 has a great collaboration with the Circle Public School District. They have a latchkey program that they're going to be able to strengthen with these funds, just overall sustaining their operations and adding slots. Lindsay? So same format here, just highlight a couple for you. Also really excited about Kids Zone Learning Center of Overland Park. That's a minority-owned, new to us program, and so in total that'll be 88 new slots coming online here in the next couple of months. They are very well positioned demographically to assist, and we all know that there's a dire need for childcare in that specific space, so really excited to work with them. Outlook Academy is another that we'd like to highlight. They are a stone's throw from University of Kansas Cancer Center. They are going to offer non-traditional hours. Their educators have bachelor's degrees. Their program director has a master's degree. They are also looking into possibly transportation services because sometimes mom or dad might be in surgery or the hospital has short staffing. So really innovative ideas coming out of Outlook Academy as well. And that is a new grantee, so one that we're very excited about. And then I'd also like to highlight for you on the next page, on the next slide please, we have Sunshine Childcare out of Pittsburgh, Kansas, and this is one that Sunshine Childcare out of Pittsburgh, Kansas. This is an accelerator applicant that we didn't fund in the first round, but once they were denied, went back and collaborated even more with their community. But this is a community that responded to a childcare crisis by creating their own 10,000 square foot childcare facility, completely separate from any funding or public attention. And so we're really excited to work with them and help fill that need. And finally, another one of our favorites is the Heritage Home, and that is in Alma, Kansas, Wabunsee County. It used to be a nursing home or retirement home in that community. It shut down. A private citizen purchased it and turned it into an intergenerational home. So on one side, there's going to be long-term care residents, and on the other, there's going to be a child care program. There's a ton of community support in Wabunsee County, and so again, we're just very excited to partner with them and see what kind of resources we can support them with this funding. So in total, we've proposed funding $11,425,500, and as a reminder, that $425,500 is the remainder from Spark that was initially awarded and then declined, as Melissa mentioned. Next slide, Lindsay. And this is a map to kind of orient you to the outlay of applicants. You'll see that our dark blue circles are original accelerator grantees. If they're a Navy Star, they were both an accelerator grantee and they were awarded for Innovation Community. If they only received Innovation Community funds, they're a Gold Star. And then this new round, so if they only received this round, they're a small light blue, and all others that had additional funding have that halo around them now. So that is kind of the outlay of our awardees. I'd like to highlight that we have new representation in Norton County, Wabunsee County, Lyon County, Neosho County, so really reaching places that we weren't able to reach before, and certainly increasing capacity. As you can see, first round of funding resulted in 4,211 slots. We'll be able to add an additional 1,468. But as a reminder, those slots are great, but we also have programs that are committing to year-round care with this funding. So the capacity is much more than that. And with that, Mr. Chair, Board, I am more than happy to answer any questions about process or our applicants.
All right, thank you, Hannah. It's a very impressive list of applicants. Great opportunity to expand access to child care and early childhood in the state of Kansas. Are there any questions or any remarks for Hannah? Yes.
morning. Thank you again, Hannah. That was a great report. This is a basic question. Can you please define a slot?
A licensed childcare slot, so a spot for a child in a licensed childcare facility.
Derek, Derek Flurlog from KDHE, in charge of, he's co-director of the Family Bureau and oversees childcare licensing.
Yeah, so a slot is basically like Hannah said, a licensed slot. So I think it is important to point out that licensed slots doesn't necessarily mean that they'll fill them. I think that's been mentioned before. And yeah, I have some stuff to mention too later on during our update, some exciting news about slots around the state as well. So I don't know if that answers the question or, okay.
All right, further questions?
John.
Oh, John.
It's not a question, it's just what continues to be a trend from staff is how well this is presented. I mean, not only your presentation, but when I think about $11 million, it's a lot of money anywhere, but it's a lot of money for childcare, and to have very kind of clear visualization of literally where the money's going, and these brief summaries is really important as I go around telling people what this money can do. So I appreciate that.
Thank you very much for your time.
Further questions? All right, I have one. Just a concern about follow-through and follow-up with these applicants. I mean, this is federal money. We have to have some assurance that they follow through and do what they promised they would do. So could you refresh for us how that works?
Certainly. So accelerator grantees have both a financial obligation and a programmatic report because of this funding. So we are already in a good cycle of getting those reports from our grantees. We just ran that yesterday. We have nothing outstanding. I've connected personally with the vast majority of these current accelerator grantees, in addition to the majority of people that applied. So we're doing a ton of technical assistance, and then the plan is to create a cycle of technical assistance where I'm checking in with each of these grantees on a regular basis to ensure that their budgets are being spent appropriately, that they're going to be able to actually spend their money by the deadline, and that if they have any barriers in their community, that we're aware of them before they become significant issues. So it's just going to be a lot of technical assistance and being on the ground floor with them.
May I weigh in? Thank you, Mr. Chair. I would say that in addition to that individualized attention from Hannah, who will also go, there will be a point where there are site visits so that she can circulate and visit the projects as they are coming online. There's more layers of oversight involved. So KSDE provides fiscal services for us, so we have to meet the standards when we submit invoices that for any state project, and they are rigorous at the Department of Education for good reason. They manage quite a lot of money, and so there are those types of safeguards in place. And then our backbone support team at KU is also providing research and evaluation support. So we will have both the compliance-driven reporting will be managed on a routine basis, and we have a responsibility to 4 different funding sources. So as you can imagine, there is a lot of that kind of oversight. Thanks to Amy Meek for stepping into the role to handle those processes for us this year. We got it. This is something that I feel good, have the systems in place. But beyond that, we'll have qualitative reporting and analysis of the impact of these funds over time as these programs come online. So you see the type of qualitative programmatic reporting that the research teams, both WSU and KU, contribute to those accountability and evaluation reports. We will continue to provide you with robust impact reporting as time goes on. So we are really pleased to be the lead on this project, but it is a full-on team effort. We owe a lot to the agencies and the sources of funding, that those funders. We couldn't have put a program like this together without a multi-agency effort.
Okay, thank you, Melissa, for that. My observation as the new guy is that the team you have put together, the effort that goes into monitoring of compliance and ascertaining that commitments and promises are kept, is kind of a model for the rest of the state government. From my 12 years as a legislator, it seemed to me there were many times that follow through and certifying that compliance was met, that promises were kept, was not always done, and I don't think that happens today. So I appreciate you being a model for how it ought to be done. Thank you. Further questions for Hannah or Melissa? Justice Wall?
Yeah, thank you. Can you, everybody else probably knows the answer to this already, but what is the difference then between the CCCA grantees versus those with that plus the innovation communities?
Absolutely. Hannah?
Go for it.
Okay. So that speaks to the innovation communities are a group of communities that are piloting certain initiatives, and so we are treating them as a cohort and meeting with them on a monthly basis and providing assistance to them and letting them collaborate and exchange ideas with each other. So our work is really to mentor a lot of innovative ideas across the community, across the state, and share those ideas and learn from them. And then our goal always is to bring those innovative ideas to the attention of others so that we can scale, we can spread and scale and put to use the information that we glean from trying new things. So we had put together for the Child Care Interim Committee, we put together a package of promising practices that we're seeing, just so that we're tracking the type of ideas and innovation that we see.
Okay. But for those that aren't part of the innovation communities, the grant recipients still represents an expansion or more slots?
Yes.
Yeah. Okay.
Yes, we I think everything you see on that map, no matter the symbol, we are expanding access to additional slots for childcare.
Great, thank you.
And just to kind of add on that, those grantees that you see with the navy blue star were awarded both Accelerator and Innovation, so they have an additional layer of wraparound. They get additional support from CPPR staff. They have that cohort that they're moving through. So these projects will be really, really well positioned to troubleshoot and to find new resources because they have additional layers of support. But yes, all of these projects that were funded had to provide additional capacity to receive additional funding.
Yes, Diane.
Yes, just one question. Could you allude a little bit more to the community matches? And Melissa mentioned some of the best practices that are shared. And how do you share the best practices in terms of the community matches? So if there's a certain, like a United Way or some other type of entity in one county or community, are you sharing those best practices or letting them know of funding opportunities in other counties or regions?
So there are wraparound projects in place. We are working with the Child Care Resource and Referral Agency, which is Child Care Aware of Kansas. for two initiatives that we are partnered with them. And in fact, all of our agencies are in it together. One is called Communities in Action, and the other is the Child Care Go Team. So Communities in Action is designed to support community planning, bringing economic partners, the local business leaders and local chambers and economic development authorities, bringing local government officials, bringing local education interests together at all levels, just getting the community around the table, philanthropy and parents and providers, and organizing the approach to evaluate the needs at the community level. So we have learned that it's easy to say, oh, it's a staffing issue, or it's a facility issue, or it's a ratio issue, or it's a training issue, or, you know, we're quick to think we have a single thing and that there is I'll revert to my Kansas Leadership Center training. We're very quick to apply technical solutions to what is a really adaptive problem, because you have to dig into what is driving the shortage in a given community. So there's not a single solution that can just layer over this from the state level, top down, let's do this and we're gonna solve it everywhere. It is, like, we are all in for Kansas Kids. This is an all-encompassing problem, and it takes a lot of willingness to think creatively and work with communities to solve the problems they're dealing with. So it is some of all of those things in places all around the state, but it's not any one thing. So Communities in Action is designed to help community leaders understand, like, we've had cities, we've had counties, we've had economic development authorities come to us to say, we know we have a child care problem, we don't know what to do about it. So we're providing the assistance to those communities with subject matter expertise to help them identify, put their finger on what the issue is and what will help them solve their problem. And then this has allowed us to bring financial resources to bear to help them address it. So we have match coming from local businesses, match coming from community foundations, from cities and counties allocating funds to support. We look for the kind of support financially that says this community is in it together to solve this problem. And so that is, the sum total of that is really specialized, localized problem solving. I think, John.
That's actually building off the match question. Remind me, to receive funding, there's a required community match, correct? And then I'm just curious to know if I see some areas of the state that seem like they might need additional support, thinking like Seward County, where I don't see any icons in there, our friends in Liberal, and just wondering, does the community match, like, if you have a ballpark of, is it the community match that could be a barrier? Is it the timeline to spend the funds that's the next biggest barrier, or which one might be the thing that, or the ability to put together an application?
Frankly, it's the ability to put together an application.
Okay.
The majority of our applicants are wearing 7 hats. I was talking to somebody out in western Kansas that is the superintendent and is trying to run a huge capital project for childcare. She's the superintendent of her USD, and she's acting as a program director. So our workforce doesn't necessarily have the capacity on staff to manage grant applications. I haven't seen a problem in the applications with the community being responsive. There's so much love in the community, and you see that represented in the matches. It's coming from everywhere, local faith organizations, or just cash, or a community investor. But no, really the barrier has been the amount of labor that it implicates for staff for already, stressed out programs.
I do want to point out that Communities in Action provides grant writing assistance. So we are trying to meet that situation. There is a special set of skills to write a successful grant application, as you well know. So I know the Kauffman Foundation has funded some grant writing expertise across the state. I think maybe, if memory serves, Kansas Health Foundation is doing the same thing. I think we are trying to recognize that at the local level, you don't always have people with that skill set. I will say that we struggled in the first round to ensure we could make grants across the western quadrant of the state. We didn't have a lot to work with to go back and spread money that into those communities. Some of it is, everything Hannah said and more. I mean, it could be the local match might be. I mean, we did screen out applications that couldn't come up with a match. That was very important to us to have that piece of the puzzle in place so that we're not fully funding a project, because we don't have the financial resources to do that. It would simplify things if we did, but that's, that isn't the way this works. So there's not a single cause, but it is something we continue to look at. I will also say that just because there aren't dots on the map in certain places, Wichita County out in the southwest is an example of a successful new child care center that we, a lot of us held hands to get them through the process of getting themselves open, but so we have other ways that we are helping.
Thank you. It appears to me that requiring a local match that displays a level of commitment at the community level that's very important. And I don't think 100% funding should come from the state or federal level. If the community can't commit to financially supporting them on their own, then I don't think that ought to be a deterrent to any application. Further questions? Yes, Leetta?
Thank you. Is there a way we can get a copy of this map?
Yeah, absolutely.
That'd be super helpful.
We'll email that. Obviously, we post the slide deck and all of the meeting materials online. It'll be up today, but we will email the board the map.
Thank you.
Yeah, thank you.
Thanks, Hannah.
Further questions? Seeing none.
Dr. Smith has
I'm
arrived.
sorry, thank you all for your grace in me getting here. With the grant writing support, is it easily accessible for people to get the support? Because I always think about people say, oh, we have grant writing support, but if people can't access it, it doesn't matter if there's support available. So is it easily accessible?
So some of it comes through Child Care Aware, which is the resource and referral agent in the state, and child care providers do know to turn to them as a resource. Our technical assistance team made referrals as well. So to the extent that we can, we do help connect people to that support.
Further questions? All right, seeing none, I'm going to ask for a roll call vote on this agenda item. We will go down the list as we see them on the screen there. John Wilson?
And just to put it out there, this is on a vote to approve the recommendations for the additional child care capacity accelerator funding.
Are you willing to make a motion?
Yes, I'll do that. I will do that. I move
All right.
that we approve the recommendations listed out in our packet for child care capacity accelerator funding.
Motion has been made. Is there a second?
Yeah.
Seconded by Deanne. Deanne. All right. John Wilson.
And I vote yes.
Dr. Tyler Smith.
Yes.
Terry Rice.
Yes.
Monica Mernan.
Yes.
Deanne.
Yes.
Leetta Felter.
Yes.
Senator Erickson.
Yes.
And Don Heineman. Yes. Motion carried. Next item on the agenda is a review of the community-based child abuse prevention grant, and that will be presented by Christy.
May I take a moment? I want to introduce Christy Wyckoff. She is a member of our cabinet team that we hired this spring as we were making our reorg internally. We elevated Amy's responsibilities, and that meant we needed somebody to take on the role of working with the community-based child abuse prevention program and the grantees involved and the early childhood block grant program. And so we are very fortunate to have Christy, also a valued member of our team, doing fantastic work. So Christy?
Thank you very much, and good morning, everybody. I'm just going to go over what the CBCAP funds fund, and it's prevention, exactly what it is. So primary prevention, which includes efforts targeted to the broader community to strengthen families and prevent the likelihood of abuse or neglect. And then secondary prevention, which targets efforts towards children and families at risk for abuse and neglect, to provide those supports. It's only for children and families that have not yet been referred to DCF. So we'll go to the next slide. So this is the slate of awards that was approved in the August 5th meeting, cabinet meeting. And at that time, we did not have our federal award yet. We received that on September 15th. And that is the $1,623,085. Next slide. All right, and so the additional funds, so we have given out the award letters to the awardees that was on the previous slide. And we're going to continue with that. The additional funds that we received, those have to be spent by 9/30 of 2025. So we have an additional year, 2 years to spend those. And we will award those out in a competitive grant in the spring. And the timeline for that RFP, the request for proposals, will be presented to the cabinet on April 5th. Next slide. So now, do you want to introduce ECBG, or do you want me to just go right on through?
No, let's pause here for a second.
Okay.
Just as a reminder, in August, the cabinet agreed that we would renew the CBCAP grantees at flat funding. So that we waited until the federal award came in to do that. It's a little bit more, it's not a lot more. So rather than coming with a plan to spend the less than $300,000 additional, we'll wrap it into next year's competitive RFP program as an amount that can be awarded. So that money will be put to use, granted out to community programs, but we just felt like it was simplest to proceed with the plan to renew grants at their current levels of funding.
So, excuse me, is there an expiration date on that funding? I mean, obviously you said we can renew it to the next year, but what is the expiration date for that fund?
So CBCAP is an interesting program to manage. It runs on the federal fiscal year cycle. So that is October 1 through September 30th. And the grant awards are awarded in 2-year increments. So we have multiple strands of CBCAP funding open at the same time, because there's always a 1-year overlap between them. So one is expiring as one is starting, but there's one in the middle so it is, there is another little tidbit of complexity from the inside. It takes a lot to manage. So we are allowed to manage those funds, so as we are nearing the end of the lifespan of a CB CAP grant award, we can spend those funds down to get the oldest money out the door and fully expended. So this will be fine. It will get absorbed into the life cycle. We give 1-year grants so that we can keep this management process, so we can keep all the balls juggled in the air appropriately. So this, Don, this was decided at the August meeting, so we can move on. Christy is also going to present about our early childhood block grant with an update.
All right, please proceed.
So currently, for the early childhood block grant, I am visiting for the first time, all of our grantees across the state of Kansas and learning about all of the amazing things they're doing in their community with the early childhood block grant funds. And so that's been really good to get to know all of our grantees and then also see the amazing things that they're doing and then can do with the funding. So, all right. So on April 14th of 2023, the cabinet approved a new slate of awards where we added 8 new grantees to the ECBG grant and then 18 returning grantees. So a lot of new projects and things going on around the state of Kansas. And so this, for fiscal year 25, so that'll be July 1 of 24 through June 30th, 25, we are recommending renewal applications for all 26 of those current grantees, which would be flat funding. And that was budgeted into the CIF budget on the June 2nd, 2023. So this past June, that was worked into that budget as so. So the funding will be, and renewal will be contingent on compliance with submission of quarterly reports and funding availability and conditions determined through review of progress and performance with me and also Dr. Schrefferman, who does our evaluation from Wichita State. So the renewal application for next fiscal year will open in the Kansas Common App portal early in February of 24, and then it will be due early March, and then we will review those mid to late March of 2024, and then have that slate to bring to you at the April 5th meeting. And like I said before, the grant year will be July 1, 24 through June 30th of 25.
So I just want to add that this, again, Christy mentioned, we approved a budget recommendation of flat funding for the FY25 state fiscal year. And honestly, this is my recommendation that we not run an RFP and open this up that we take a breath for a year and renew the existing slate of awards. I think with the additional funding streams that our staff is bringing online, the staff of 6, I think we still will be talking about the next new thing that we're bringing online. We would normally be starting the ECBG RFP process in late November, and it's just, I think it's good to take a breath. My recommendation would be to renew these grantees, so it's one less grant application that they are all writing, and we pick up next year. We get back to a full-on competitive RFP process. So this one is it's somewhere I visited with Dawn to prep for the meeting. If anyone has thoughts from the board, I'm open to a different opinion about how we might handle this, and we can discuss. But I think I'm seeking permission here to proceed down this path.
Understood. this is really just approving staff recommendation for flat funding. So are there any objections to that? Seeing none, we'll take that as board approval.
Do you have a comment?
Oh, John, sorry.
Don't let your heart race. I'm not objecting to anything. I just, as an organization that receives grant funding, I also think of it, I think it's great to save your staff time and energy, but I think about the grantees. So I think there are multiple reasons why this is a good idea, and I also would just highlight the continued constraints we have on a limited amount of our CIF dollars going to this evidence-based ECBG program. And so as we continue to think about freeing up funds to put towards that, that means more folks can kind of get into that mix, but have no concerns, and in fact, really support this.
All right, good. All right, seeing no objections, we will proceed to the next agenda item. Melissa, Capital Projects Fund Accelerator.
Yes, thank you, Don. So this brings us to the next new thing. We touched on this a couple times earlier this year at meetings. This is the Capital Projects Fund Accelerator, which is a funding program that it's funded with a brand new source of federal ARPA dollars that the cabinet successfully was awarded. We found out about a week or two after we had awarded the Child Care Capacity Accelerator grants that we had cleared all of the hurdles in the process with the U.S. Treasury Department and were approved to proceed. So I want to back up and give a bit of the history of this. American Rescue Plan passed in 2021, and it included a particular bucket of funding for broadband infrastructure. Subsequent to that, Congress passed a very big infrastructure bill, and there was significant funding for infrastructure passed through separate legislation. So at the congressional level, federally, they went back and revisited the criteria for this fund to broaden the categories of use. We found out that they had added a category, so it still is a bucket of money that can be used for broadband, and there needs to be a broadband element to successful project applications. But they opened up this new category called capital projects, which are community facilities, multi-purpose community facilities that support employment, healthcare monitoring, and education. So we took a look at the criteria, and in December of '21, the cabinet submitted an application with the approval of the Office of Recovery. We submitted an application that centered child care at the heart of that. Our proposal was to build child care centers, and we created we made our case, our best case, that child care facilitates parents reporting to jobs, right? That's a workforce issue, that you have safe, quality child care for your children. We talked about the education and the brain development and how important it is to have quality child care and the education of young children in those environments. And we gave examples of the kind of healthcare monitoring that could be built in. So a room in the center could be dedicated to having a private room for telehealth visits and making that easy for families to access the kinds of services that were being provided during the pandemic. Especially that became the forefront, but it's a good practice anyway. So we well, yeah, the broadband would be that connection to telehealth, and the building would be, wired, or if wiring is still a thing in that realm, I don't know, but it would be set up with the right technical capabilities. You could have exam rooms so that if there was a visiting dentist, that those visits could happen, or any number of examples of ways that healthcare monitoring can happen in a program that is providing wraparound services. So we submitted that in December 21 with really high hopes, and we went through a period of time of radio silence. And then we finally, last summer, began to have meetings with US Treasury, and the first response they gave us was, nope, this is not what we mean. And so we had to retool. We had to get back to our project proposal and rethink how we could qualify for the funding and achieve the goals that we envisioned for these funds while complying with some specific federal criteria. That was this 18-month-long process, and we finally succeeded. But so I spend that much time on that background because this funding program will require that the facilities that are successfully funded are not just child care facilities. The big victory was we got US Treasury to approve our desire to require that child care be a component of successful awards. So while we could not only fund child care, we are allowed to make sure the funds only fund facilities that include child care slots. So this too will help meet the demand for more childcare across the state. But it's bigger than that. It's a multi-purpose community facility that supports employment, health monitoring, and education. We have terrific models in a couple communities in the state to build on. So we are working, again, providing the kind of technical assistance that we provided for the first accelerator grant program. Hannah is actively engaged with not just the new awards in the Child Care Capacity Accelerator, but also the RFP process that is going on. So we we've got $38 million for this program. This time it is construction only. We cannot fund the operation startup costs, that we don't have a source of funding that allows that. So these funds can only be spent on construction. As I mentioned, it's US Treasury ARPA funding that originally was their broadband funding plan. The projects that will be successful must have explicit design considerations that enable all of the criteria, not just some of it. And Treasury is requiring us, and it's good, you know, we do this in our grant making anyway, but they must provide sustainability plans that show operational stability over the course. That they're requiring a 5-year plan that be provided as risk assessment of these projects. And in this one, we are allowed. There will be 15% match required. So there is really bright lines of allowability that will be the very strict scrutiny that applicants are put under. I think you can go to the next slide, Lindsay. So we opened an RFP for this on September 5th, and we've got 2 tracks going on. So we recognized in the Child Care Capacity Accelerator grant applications, there were several projects that were written for the other grant program, but met the criteria. We saw in their game plan all of the elements that a successful applicant for this program would have. So at the time we made this decision, it was very risky, but we counseled them that we were in the final stages. Treasury had come around and was just needing a couple technical details from us from a process standpoint. So we said we feel really good enough to risk not funding you in the Child Care Capacity Accelerator and offering you the opportunity to move your application to the Capital Projects Fund. So we opened a public RFP all of the programs that we had coached to wait, be patient, and reapply to this program did, which made us really happy. There are review happening, the review is going on as we speak, and this is the slate that we will bring forward at the October 19th special meeting of the cabinet. That will be at 11:30 based on feedback that I got from board members, and it will be a virtual meeting. It should not take long. It will be a small group of projects. This one we're going to, I don't want to give a specific cap on round one, but our intention is that we land at roughly 8 to 10 million-ish of the 38 million, so that we preserve the bulk for the longer term time horizon. We didn't want to give it all up to the ones that fast track their applications. We wanted to balance the opportunity. If the first round is a little more because we see really fabulous applications, we're willing to go there, but I want people to feel comfortable that the application window that will close December 18th will still be highly competitive and offer opportunity to receive consideration. So both rounds opened at the same time. We're just giving communities the option to apply now or apply later, and whatever timeline they need. So all the technical assistance that we are known to provide is being provided, and we will bring you a slate to consider in October. I think the December 18th group, that cohort will be brought forward at our regular meeting on February 2nd to minimize the special meetings. So the funding, there is a spending end date on the ARPA funds. So we've got some spending timelines. We anticipate getting the first group set up in November of '23, and programs will, from, I'm not sure what that bottom timeline actually means. September of '25 is the outer deadline, so we will manage the funds according to the federal timeframes. Before we leave this slide, I want to point out, especially to our viewers online, the website at the bottom of the screen is the source for requesting assistance. We have allinforkansaskids.org, and then you use the community drop-down menu to pick the Capital Projects Fund Accelerator. We post the RFP, we post all the links to get technical assistance, we post all the resources, FAQs, recordings of the webinar that we gave, like all of that information can be found online. So with that, Mr. Chair, I would be happy to stand for questions.
Okay, thank you, Melissa. My observation is that it's only a slight exaggeration to say you have successfully bent the U.S. Treasury to your will. I mean, really, it's a 2-year process of time and focus, and this is the result. So
well,
thank you and your staff for that.
I would be remiss if I didn't mention that my husband would tell you, woe unto those who tell me no.
This is great. Can I make a comment?
All right, questions or remarks? Leetta?
Yes, I love that. Bend the treasury to your will. Melissa, this is, I know you just kind of stated it, just kind of matter of fact. This is amazing. So, I mean, I have goosebumps. Without you just knocking on the door over and over, we wouldn't have this.
I have a team that we would, without all elements, we would not be as successful as we are.
It's a great team, but
It
they
is.
need a fearless leader too. So we are so grateful. Kansas kids will benefit, and our families in Kansas. So thank you for this. So grateful.
Questions, remarks? All right, seeing none, there's no action required at this time, but we will be reviewing the applications on October 19th. Moving ahead to agency updates. Amy,
I'll kick us
you're
off.
up first.
Okay. I'm going to give a few updates on some of our grants that we haven't mentioned already this morning. And the first is our preschool development planning grant. And that grant is our second of the preschool development grants that we've received. They're both overlapping. So we have a 3-year grant award that started April 30th of 2020, and we were given a 1-year no-cost extension, so we're really spending those funds in 4 years. That will wrap up April 29th of next year, and so we're kind of in our last phase of that. But we were also given the planning grant December 31st that started of 2022, and that'll go through December 30th of this year. Right after we met last time in August, I think mid-August, we received notice from the Children's Bureau, is that who, yeah, administers that grant, that they wanted to give us additional funding. They had some funding remaining, and they decided to divide it up between the states that are currently funded. So we found out we could apply for an additional $860,000. But it was a pretty quick turnaround. We met with our internal team and our KU team that helps us to kind of do some planning on these, and decided a good place to spend that $860,000 was to pilot the Baby Steps program in Wyandotte County. And the Baby Steps program is currently happening through Child Care Aware and funding through the Patterson Family Foundation in rural counties. So we decided we could pilot this in an urban setting and find out how it works in that area. It's an innovative approach to helping child care providers that take infants and toddlers be sustainable, be able to have additional revenue, because it costs more to take on those infants and toddler slots, because you can serve less than you could if you have preschool age or school age. So it's to help them offset some of that revenue and incentivize them to take the infants and toddlers. So we're excited to be able to see expand that into Wyandotte County with those funds. We do expect that we'll be able to have a no-cost extension of another year, thankfully, because that's a lot of money. The original grant was $4 million, so another almost $1 million means we need a little bit more time to get that money spent. So we're going to be applying in the next month or so for a 1-year no-cost extension. That'll give us time to spend those funds all the way through 2024. And drafting of the needs assessment and the strategic plan, which is the main part of that grant, is underway and happening, and I think we'll have some updates in upcoming meetings on that. One other new grant that we have since we met, we found out that, again, in mid-August, that we were awarded a discretionary grant through the Children's Bureau of Child Welfare. We applied for this back in the spring, so it was a little bit of a delay, and we applied for this, and not that we'd forgotten all the way about it, but we have a lot of things going on, so so we received notice that we will get an award. It is a 3-year grant, although they're awarding the money out in 1-year cycles. So our first year, we're getting about $275,000. It started on October 1, and it'll run on the federal fiscal year. It is, what we're calling ours is Kansas Linking Infrastructure for Nurturing Kids, or we'll be referring to it as CanLink, because that's quite a mouthful there. And really what it's designed, and what we had to apply for the initial grant, was to help with coordination, alignment, and infrastructure between child welfare agencies and early childhood systems and programs. And so how we can, help coordinate better for families and have them have better access to those early childhood programs and do some prevention work. So we're partnering with DCF on this, also the University of Kansas Center for Public Partnerships and Research, and also the University of Kansas School of Social Welfare. So they're going to be kind of helping support and leading some of the stakeholders getting together. We're going to be including also Kansas Children's Service League, and then also the Family Resource Centers that were recently awarded through DCF funding. So this is going to be a really cool way to incorporate them as they're new in our state, and helping them to coordinate some community-led innovation labs, helping them to figure out strategies that will work in their community with all their partners. And so we'll be helping them with a little bit of funding to do that and to do those innovation labs. And then, of course, we'll be working on the state level coordination. So we will bring you some updates on that, but it just kicked off and had a first meeting. So still kind of a little bit getting the group together and finding out what other stakeholders need to be at the table as well. So that's all I have. I can answer any questions.
All right, thank you, Amy. I assume we will get updates on that new program as we go along?
Absolutely.
Yeah, all right, thank you. Next up, Amanda, for, I'm sorry, question?
Thank you, Mr. Chair, and thank you so much, Amy. It may just be me coming in midstream in a lot of these grants, but is there, and I apologize if this is already available, is there like a one-stop shop that would say, these are the grants that we currently oversee, here's the amount, kind of, is there kind of like, in my mind, a spreadsheet to kind of track all these and the agencies involved? Because my head is it's a wonderful problem. It really is,
yeah.
but just so I can keep them straight in my mind, is there a chart or spreadsheet or something somewhere I can tap into?
Well, if you came in my office, you'd see a big Gantt chart with the 15 reports that are due this month, and because it is complicated. We run some of our programs on the state fiscal year, some on the federal, some are on a calendar year. So we internally also make sure we're tracking all that, but we're happy to give you something. That would be great. And on our website, we highlight our different programs, but it doesn't always show the different timelines and how they may overlap. So
I would, absolutely, all of that. And so yes, we will provide the cabinet with an interim report on the grant package that we manage. But our annual report is always, there's so much that's changed since last year. We're working on the drafting of the 2023 report as we speak. That work is underway, and your December meeting will revolve around the receipt of the annual report to the board. But as we will add a new infographic to this year's report with all of the new and different sources of funding. We're just grappling with how to visualize the magnitude of the new and different sources of funding that we're working with. So it's a great question.
Thank you, Mr. Chair.
Thank you, Senator Erickson. I share your concern as the new guy. And it's in the annual report, but that's a historical document. And this team is so involved and so innovative that historical document doesn't tell the whole story. So I appreciate that question.
It's new to us too. We've had a lot of awards come at us in the last several months, so we are getting our feet under us to be able to report out in a way that is manageable and clear.
Deanne.
Thank you, Chair. Amy, just one more follow-up question. Apologies if I missed this, but on the discretionary grant that was the 3-year grant cycle, you mentioned $275,000 was the funding for the first year. Did you mention years 2 and 3, or what the overall total was for that grant?
the overall total is about $750,000.
Okay, thank you.
And we haven't been told what years 2 and 3, but when we submitted the application, it was for a 3-year. And then we had to submit break it down into 1 year, because that's how they're gonna do the awards.
Okay, thank you.
Further questions for Amy? John?
Yep, thank you. Senator Erickson and I had similar thinking. I like scribbling down timelines here, almost making a Gantt chart in my mind. So I want to make sure I'm tracking as well. So the PDG grant, preschool development grant, that we received in 2020 ends in April 29th of 2024. That's what funded the initial needs assessment, the all-in for Kansas kids. This isn't the thing, but the strategic plan itself, the updates to the strategic plan, no? Okay. So
The planning grant is, that we received for the 1 year, is providing funding for the updates to those.
Okay, gotcha. And so, but the PDG concept from the federal government, was that kind of a one and done thing? And can we anticipate?
So, I think we currently don't have an answer to that. The intention was to provide potentially an additional round of implementation funding for the states that have the current planning grant. I think there's an open question about whether the resources are allocated federally, given the current situation. which
And,
I
yeah,
don't know
and
is
I'll add
predictable.
what we've been told, if there is another round, they want to shift it to the federal fiscal year timeline, rather than, ours is end of April to the end of April, and there were some others that were on the calendar year, so they would like to shift all of those to the federal fiscal year, calendar year, so beginning October 1st. But it's still, like Melissa said, they're not sure.
Okay.
Yeah.
Yeah, it just feels like it's been around for a while, and I think the no-cost extensions help keep it alive, but so.
And the
looking forward to
no-cost
that
extensions
snapshot.
really help us to make sure that we're spending the money wisely, and rather than.
Buying office supplies for
Right,
the
like,
end of the fiscal year.
and we give more time, then we're really giving programs time to spend the money. And KDHE is still using some of the money from the no-cost extension of the 3-year grant, and so, yeah, it's been helpful to be able to do that.
Further questions? All right, thank you, Amy. We'll move on to Amanda Peterson with Department of Ed.
Good morning, everybody. I have 2 updates to share today. The first is both a preview of what you can expect to see in December and a request for the folks here and for anybody who might be listening online. And it's about the Kansas Early Learning Standards. So these are the standards that are about what we want our Kansas children birth up until age 5 to know and be able to do in different domains. And I am so deeply grateful to the very many Kansas early childhood professionals who have dedicated a lot of time into reviewing these standards, which were last updated in 2013. Over the last year and a half or so, the group has done amazing work to look at these and consider how we can make them as streamlined and as effective as possible for our Kansas early childhood educators who might be using these across a variety of settings. So from home visiting and parent education to childcare to school-based preschool and other early childhood settings, we really do want these to be consistent standards about what we want our Kansas children to know and be able to do. So in December, you will hear a much more detailed update from the team that has been working on this. And I really look forward to that as you all look to act in your role as the Kansas Early Childhood Advisory Council to approve those standards. But in the meantime, I mentioned a request. We've done great work so far to engage targeted groups of people who care about and are experts in and use these standards, including by working with our Kansas Early Childhood Recommendations Panel, which is the committee that serves as an advisory group to you all as the Kansas Children's Cabinet and Trust Fund in your role. However, we wanted to really make sure that everybody who has an interest in these standards gets the opportunity to share their thoughts and feedback. And so on Monday, October 30th, from 4 to 5 p.m., the Kansas State Department of Education will be hosting a Zoom where people can come and share their feedback. that we will be sharing this out in the All In for Kansas Kids weekly email update. But if you're really interested to dig in and take a look at those standards, you can go to ksde.org. Eventually, it will be on the scrolling banner on the homepage, but in the meantime, if you click on the alphabet at the top and click on E and then click on early childhood, it's right there on our homepage, and there's a copy of the draft standards to review, and then also a link to register for that Zoom on Monday, October 30th at 4 p.m. So we have been so appreciative so far of the feedback that we've received. We think that they're in terrific shape, but we really want to make sure that we have the chance to share those. We'll also be presenting those to the State Board of Education at their November meeting to see, and then at their December meeting to approve. So we are so thrilled, and I also, the standards are in the phase where the KSDE Communications and Design team has them. I cannot wait for you all to see the final version of the document. It looks so great. It's not on the website yet, but it really is a nice update to standards that have been used for a while, and we're due for a refresh. So I cannot wait until we're able to show those, because we've really worked to make sure that those can be something that people can use in their daily work and that can be really useful in that work. So that's update number 1. And then update number 2 is that we have a line to add in our spreadsheet in Kansas for the grants that we've successfully received. The Kansas State Department of Education has very recently, last week, received notification that we've received a grant from the Institute for Educational Sciences from the United States Department of Education. It's the next round of the statewide longitudinal data systems, or SLDS grants. And in Kansas, our incredible IT team worked together with partners from other early childhood state agencies. This 4-year grant project is going to be entirely focused on really upgrading the way that we as a state gather early childhood data. And so we will be sharing much more about this in coming months. Our IT team will be hiring a full project team, and we can expect to bring folks together to talk and share more about that. But in short, this really builds on the work that the Kansas Children's Cabinet and others have championed to make it so that when we serve a child at the Kansas State Department of Education, and the Children's Cabinet also serves a child through, say, one of the other grant programs that we've discussed here, right now we're not able to tell how many unique children are served. We know that there are children who perhaps go to a school-funded preschool, not perhaps, who do go to a school-funded preschool in the morning and then go to a licensed child care facility in the afternoon, or whose families need wraparound care for the rest of the year. And we're able to provide counts for each of those programs, but we're not able to really get that sense of which children we're reaching and which children we're not. We're not able to compare that to census data to understand the total reach of our early childhood programming in Kansas. And so this grant is going to enable us to be able to use the system that the Kansas State Department of Education and schools already use to assign a unique identifier or a unique number to each child upon enrollment. Again, this is a place where the technical is relatively easy, I get to say, as somebody who is not on the IT team and will not be doing the technical work. But the work of actually adding this field into different agencies' databases so that they can add in that number, or in, adding the users who are able to add a unique identifier the first time that a child enrolls in a program, that piece is relatively easy. But the adaptive work of doing the training and working together with programs at the local level to adjust their workflows so that when a child enrolls in their program, they're taking that step to first search to see if the child already has a unique identifier, and then to assign one if they don't. That's going to be the hard part. And working together amongst agencies to then say, okay, we have this data, and how do we share it, and how do we use it in a useful way that is also still incredibly protective of student and child data privacy, is going to be hard work. So we're looking forward to that. I would be really remiss if I did not publicly acknowledge and thank Dr. Terry Garska, who in many ways has, at KU, who has just taken our Kansas early childhood data work to a different level over the course of her career. And we had a very short turnaround to write this grant without the work that the team has already done to improve our Kansas early childhood data systems and work together to share. I doubt that we would have been able to put together close to as strong as a proposal as we could have. So we are very excited about that, much more to come. But we were really pleased to get that news last week. So I'm glad to answer any questions.
All right, thank you, Amanda. Questions? Renee?
Thank you, Mr. Chair. Thank you, Amanda. As a former parents' teacher educator, I'm sitting here thinking, okay, can you give an example how the standards have changed? I'm thinking, we know by a certain age they should be able to track or fine motor skills. And so I'm just trying to think how birth to three, how standards have shifted. So can you kind of give us a little bit of more information or point us to where we can see maybe some of the changes?
Absolutely. So visiting I think that you would really enjoy visiting ksde.org and going to early childhood to see the updated draft, and I'd be glad to share them with you. I would say that it's less about fundamentally what children know and can be able to do, and more about considering opportunities to make the standards a really user-friendly document for our early childhood professionals. So taking a look to make sure that standards are not redundant across multiple areas so that there's less to focus on was a major area of emphasis. In 2013, I would say it's fair to say that the standards review and revision process was very focused on looking at the kindergarten through 12 standards and making sure that for each kindergarten standard, there was an accompanying standard for 4 and 3 and 2 and 1-year-olds. And, sometimes there are things that we hope that our 6 and 7-year-olds can do that just don't necessarily have a good foundational equivalent for a 1-year-old. And so we really took a look at those to consider where we could consolidate and where we could simplify language. So that's not a direct answer, but Amy, could you please, so Amy serves as one of those folks.
Yeah, I'm on that committee that has been working on those revisions. Also making sure that the language is just clear and people know the terms that are used in there. And so we've kind of cleaned that up so that if a parent reads it or picks it up, they understand it. And then we've added some definitions or a glossary so that for some terms that may be more used for professionals and not, just a parent that might pick it up. So, and like Amanda said, there was a lot of redundancy. So a standard for an infant was the same standard was in multiple places. And so trying to clean that up and also make sure they just made sense as you're reading across the language type. It needed a lot of cleanup of wordsmithing and those types of things. So, yeah.
That makes a lot more sense, because I'm thinking, how much do babies, I know my grandbabies are super babies, but in general. So that makes a lot more sense to kind of tie that together. So thank you for that clarification. Thank you, Mr. Chair.
Further questions? Melissa?
Amanda, I trust that at the appropriate time, you will make sure that we can share links and opportunities for public input and all of that so that all of our channels are working to publicize, right?
It is on the to-do list, I promise.
Awesome, okay. And then I want to cheerlead the grant that was landed. As I think about all the ways, all the questions that come up in my own mind, harken back to my days in the legislature, certain questions that we just couldn't get good answers to, and the shared desire to improve academic outcomes for kids, understanding the population that is and is not being served by the programs and services that are in place, and how we get there, and what the impact of those things are, being able to look at the continuum from birth through 20, as it were, because I know we have done a lot of work at the other end of that continuum to have the longitudinal data available to really follow and understand the impact of the work that we're all engaged in. I think this is going to be a great boon to the state.
Monica?
Thanks. I would just want to respond, Renee, because I kind of like you, child development's child development. But I do think the difference, as a person who sat in when the first standards were written, let's just put it this way, the process started when my kid was a freshman at KU, and it was not done when she graduated. So it was painful. So thank you for doing it and updating it. But I do think the thing that is different from that point to now is we know so much more from science and technology about how the brain develops. You know, before we had some good studies and such, and now we know so much more. And I think specifically we know more about social emotional learning and 0 to 5. I think we know so much more about how we can, through standards, influence environments. I think that's the difference rather than it just being cut and dried. This is child development. You go from this step to this step. And I think those standards, not only do they help guide the staff, but they help guide programming. And it does, I think it's a bit different, but it's still, you know, baby's brain is one of the most incredible things there is. So being able to put that on a piece of paper is really hard. So thanks to everybody who did the work.
Deanne?
Thank you. So I have a little bit of a, I don't want to say generic because it's not generic, but just a question as it pertains to COVID-19. As a mom of 2 young children, at the time during COVID, my youngest was in daycare, my oldest was in 2nd grade. Now they're in 2nd grade and 6th grade. What has the department been doing as far as measurements, looking at outcomes, kind of reverting back to pre-COVID measurements, and really just helping with that gap of the time our children were not in school? And if you could just elaborate a little bit on what you're seeing and what types of studies are being done for the time that our children were not in school.
Absolutely. One, I would say that anybody who is really interested in student achievement in Kansas might pencil in next week, Tuesday, on their calendar. We're going to be releasing the most recent state assessment results. I would say that it is really a lot of the measures that we have when we're thinking about that statewide question are lag measures, right? When we're thinking about a state assessment result that measures what a student knows and is able to do in a particular grade, that really is taking it takes a long time for us to finalize that data and be able to release it. But it also, you get that measure while a child is then in the next grade when we're thinking about our post-secondary effective rates, right? Or the rate at which children are going on after they graduate. That's a 5-year rolling average. And it happens after children have graduated. So I think especially in early childhood, that's a question that we think about a lot, where we're trying to understand, okay, what happened? Like, what did that mean for our COVID babies who are now 3 and 4 years old? It takes us a while to be able to have that kind of good statewide assessment data that is something that's really comparable. We have many more districts that are using FastBridge and other interim assessments to be able to get again, not real-time data at the state level, but more timely data. And so that's certainly something that we're very closely monitoring and then comparing those results to our state assessment results. I think when we think about early childhood in particular, something that our team in the birth to 5 space is monitoring very closely is our statewide usage of the Ages and Stages questionnaire, or the ASQ screener, which measures risk, birth up until kindergarten entry, of potential delay in a number of both developmental and social emotional domains. We've been able, through the preschool development grant, to expand so that it's not just school districts who have access to that, but also in partnership with our Part C early intervention services. We've been able to make that infrastructure available to any early childhood provider statewide. And so we're now screening more children for potential areas of risk than we did before, and seeing where there might be. And it's, again, a little bit difficult because as we're looking at that aggregate data, the population is changing as we're growing the number of children served and the number of providers who are participating, and so it's not an apples-to-apples comparison when we look to historical data. Do those things answer? I can talk about other things too, but that's a big question.
Yeah, it is a big question. Sorry. It is a big question. I think it's just, and a lot of it we just don't know, right? It's, or yet. And so I think it's just understanding what the state is doing with that continued measurement and plans for how we do look back and prepare for the future for these children during that time frame.
Well, and I will say it is not a data-based answer, but I and we are very lucky to get to visit with very many both school-based and non-school-based educators on a regular basis. I would highlight the work of the Early Childhood Transition Task Force in the last week of June to hear from 500 Kansans about what they're seeing on a day-to-day basis. I would say that there's not a conversation that I have with educators or school administrators that does not note and reference the stress that families are experiencing and the increase in behaviors and mental health needs that they're seeing really from birth through high school and into young adulthood. So anecdotally, if you were just to ask me, you know, what do we know or what is our sense of how we are doing in the 2023-2024 school year, I'd highlight that those enduring stressors are pieces that are certainly still with us and that we are working, that are, I think, front of mind for most school leaders and early educators on a daily basis.
I would just add that in August, when we received the report from Dr. Schepperman, it's the impact of our birth to 5 programs and our specifically the early childhood block grant, that continuum of supports. But if you remember, we saw a bounce. We saw growth and recovery from pandemic lows in those evaluation measurements that we work with our grantees. And I know that schools across the state there's a quarterly report that is published on the Department of Education website about use of the federal pandemic dollars. So there's a lag because you have to close a quarter and then you have to process the data. So it's a quarter behind, and in deference to the work being done to prepare for next week's state board meeting, the report that gets published in October is secondary to the prep that's going on within the design team to get all the slides and visuals and reporting organized. But there will be a new quarterly report out sometime this month. So, they're kind of balancing some specialized interventions and looking at ways schools have used those funds to address learning loss and pandemic recovery, the learning recovery efforts. I think it's, as an outside observer of all that, it's been an all-hands-on-deck approach to encouraging more kids into summer school programs where necessary, with the extra boost from pandemic dollars, but all kinds of extra programming going on. So I think we see it both in our birth to 5 space and in the K-12 space as well.
Yes, Dr. Smith.
Thank you so much for your presentation. I want to know if you can share a little bit about in terms of what are the professional identities of the people that have been part of the group revising the standards, because of wanting to make sure that we have a diversity of thoughts and inclusion of various thoughts from different stakeholders. If you could just share that, please.
I'd be glad to now, and then I'll also note that when we present in December, we'll have that complete list and that group. But we've pulled together a group that is a mix of agency personnel, folks who train on the standards, and then folks who use them on a day-to-day basis. We've made sure that that's something that encompasses the multiple sectors that are represented, so thinking about home visiting, special education, general education, childcare, preschool. For each standard area, we pulled together a team of content experts that, and as I'm thinking about those groups, those would also have included a lot of trainers, a lot of some higher education folks, teachers, so others who teach in those specific content areas. I'd be glad to pull together a complete list of the people who have been represented so far and make sure that we include that either in follow-up to this meeting or when we present in December.
Thank you, because also thinking about just other people who interact with children, maybe not directly in the school setting, but are more kind of, I would say, adjacent to the schools in terms of our social workers, healthcare professionals, things like that. Those are the other identities that I'm wondering, because sometimes we're in these very siloed systems, and then we don't know, oh, these are all these great things that are happening, so making sure that we're breaking down the silos and bringing all the stakeholders in place, even if they're not part of particular agencies and everything too. So if you can provide that information, that'd be helpful. Thank you.
Further questions? Yes.
Okay, there we go, Red. Thank you. Don't have a question really, just a comment. And listening to you talking, Amanda, your example, your grant that you got with the assistance from your colleague at KU, and then it circles back to the comment that John questioned you, I think, Hannah, as far as the grant applications. I think that's a really good example that speaks to the importance of accessibility for grant writing assistance. So I just throw that out there because that was a great example that some of these organizations that perhaps could fill the void of some of the issues that we have, they just may not have the capability to fill out the grant application. So I just want to throw that in there. And then just another comment. You know, I think I've told you this before, Amanda, your weekly reports are amazing. So I look forward to getting them and reading them. So it's a great job. And your passion just exudes in the reports that you guys provide. So thank you.
Thank you. Further remarks or questions for Amanda? Seeing none, Amanda, thank you very much for your report. Next will be Derek with KDHE.
Thank you, Mr. Chair. Good morning, everybody. I'm Derek Flurlog. I'm one of the co-directors for the Bureau of Family Health at the Kansas Department of Health and Environment. Jessie, my colleague here, is the other co-director, so I'll let her give her portion of the update directly following mine. I directly oversee child care licensing and then the state WIC program for KDHE. And I figured I'd structure my agency update for you guys in kind of the same way that I've been approaching some of our local health departments, stakeholders, providers, lawmakers, Kansans in general, even federal folks, I guess, so just we'll say Americans, to understand the structure and our approach at KDHE to child care licensing specifically. I think you all are experts in your career fields, your professional life, personal life, but also in your community, so anytime I can arm you with statistics or data or general information so that when somebody comes to you and asks you a question or makes a remark, you can say, well, actually, or you can say, yeah, that is unfortunate, but I know who to get you connected to. So that's what I'm going to attempt to do today. Child care licensing specifically, we have two separate, I shouldn't say separate, they work interchangeably, but we have two kind of focuses of that program. So we have our operations kind of branch of the program. That's going to be what's located here in Topeka. They process all of our applications. Jarvis Dolman is our operations director. He oversees that portion of it. So we also have our field. Our field is what contains our surveyors, which we are now calling licensing specialists. We want to get away from the term surveying. We also want to get away from the term enforcement too, by the way. That's changing to monitoring. Both of those terms we're not big fans of. We want to come from an angle of being supportive rather than like the iron fist of regulation or law. So those are the kind of the two angles that we come at child care licensing from. Our licensing specialists, of course, we have some that work directly for us at KDHE, and then we also contract locally with some of our local agencies to provide those services for us. All of the applications go through the state. Our license types, this was kind of an answer to the child care slot question earlier. A slot, obviously, a licensed slot could be an open space for a child of a particular age. It just depends on the license type. So currently we have daycare homes, we have group daycare homes, we have centers, we have school age programs and drop-in programs. Something that we've done with our proposed regulatory revisions is to remove an administrative burden within our daycare homes. Instead of having two license types, we are proposing to go down to one. What we've seen with having two license types for homes is that if somebody wants to switch from being a group daycare home to a a licensed daycare home, it's an administrative burden, and it's just for the state, and it makes absolutely 0 sense. Requires a new application, it's paperwork. We don't like that, so get it out. We'll be hopefully moving to the term family daycare home is what you'll see. So trying to cut some administrative burden off of that. Some of the portions of our kind of our funding. So we get most of our funding from CCDF funds, which is federal funds kind of come in through DCF. And, with federal requirements, kind of what Melissa and everybody has spoke to, we do have some barriers that come along with that. One of our biggest challenges at the moment, and Jarvis Dolman, our licensing operations director, spoke to this in special committee last week, is fingerprints and background checks. So we're really focusing on ways that we can help make that process more efficient. It is a national problem. We learned at our state and territorial administrators meeting, a couple months ago now, I think. There are several, not just several, all states are really struggling with it. They were trying to point out how Connecticut was a model, and they're like, they're doing this in Connecticut and it's working great. And we're like, oh, how long does it take to get from border to border in Connecticut? It's like an hour and a half or something or other. I can't get to Wichita in an hour and a half. So we're just, trying to do some unique things. I think we've got some existing agreements with DCF to do some digital fingerprinting with something called a live scan machine, and we're really looking to expand that program as well, discussions with law enforcement across the state, and really making sure everybody has the info that they need to do those sorts of things. There are other, waivers that they have to fill out per the FBI, and just some other outstanding obligations that can be a barrier sometimes. The good news on the fees side of that, I guess, is that our licensing fees and background check fees, those are covered. Those have been covered for the last several years, and those are going to continue to be covered. So thankfully, DCF, through an agreement with them, will have those fees covered through 2024 at this moment, and hopefully beyond, to be quite honest. So kind of cutting any barrier that we can cut down for provider entry into the field is important for us to look at. I also wanted to give you guys a little bit of data. We provided this to the special committee last week, but I just thought it really hit home. So I wanted to talk just briefly about that. So our facilities overall in Kansas, you've probably no surprise to you all that the total number of facilities has declined for the last several years. If you look at a graph of it, it's a pretty steady decline. If you break that down a little bit further, month to month, especially since January 2022, we've actually seen an increase in those facilities, so that's been good to see. We've seen number of applications coming in increase as well. So and processing times cut down. So that's all kind of leading to more efficient work at the state level, which is good to see. And a huge shout out to our operations team for getting those things handled. Probably the biggest thing to note is that the total number of slots that we have available, so those licensed slots for children across the state, it's the highest point it's been in 15 years. It's the highest point it's been since we started tracking the metric. We have not pulled September's numbers yet, so this is going to be as of August. But our total slots, total licensed slots, which again, this is kind of that capacity to serve. This does not mean that a provider wants to fill all of their slots just because you're licensed for 12 or whatever it may be. It does not mean you want to put 12 children in your program. It's provider dependent, but that capacity to serve is 142,807. And that is an increase of a little over 8,000 since December of 2021. And we really attribute that, I think, mostly, of course, there's been operational improvements, but then we've seen funding opportunities too for providers, whether it's been startup grants, health and safety grants that are, helping them meet certain regulatory requirements, new construction, some different pilot projects. So I think one of the concerns that we do have is that with the funding kind of drying up a little bit, especially from the federal side of things, is what will happen to some of these providers. So we're monitoring closures very closely, and we're also doing a couple different exit surveys for providers that do close so that we can gather that data. Are you closing because it's a funding issue? Sustainability on your end, what's the issue? Is it regulatory? What's going on? So those are some of the items that we want to know. Outreach. I'll just mention that we've tried to increase our outreach efforts. Last week, we presented to the Kansas Healthcare Association at their annual convention down in Mulvane. I am a previous long-term care director, so I hold that kind of industry close to my heart. And so intergenerational care, that was awesome to hear on the packet. And Jesse's got that background too, so I was talking to her about that. We went and presented to them. KDHE actually has an existing MOU with KDADS, and it's a little more complicated than this, but essentially we can go into a long-term care facility. KDADS can decommission a section or a room of a licensed long-term care provider, and then we can swoop in and say, oh, that's child care. Because with long-term care facilities, they often are up to code, and things like that. So it's a seamless transition, we hope, and it's kind of one of the opportunities that we want to promote around the state. And we're looking at making a checklist and packets like that for long-term care providers that are interested in doing that, to say kind of here's where you start. So that was a good opportunity. KDADS was in the room with us too, and we actually had a provider, Clint Arndt, who operates Sunflower Care Homes out of Emporia. It's a Home Plus setting that he operates down there, and he's also getting ready to open one. I want to say Garden City. And so he gave kind of his perspective on things, and it was a really great opportunity for the providers in the room. We actually had a packed house. We were one of like 3 or 4 sub-presentations going on at the same time, so it was good to see the room full. And really good, I think, for the providers themselves, not just for the state to say, here's it from our angle, but for him also to then promote, well, here's what it looks like from the provider. And he kind of uses his as a retention tool for employees. So not everybody can do this, but like daycare costs for his staff, it's like $35 a week, which is unheard of. He doesn't do it to turn a profit, but he uses it more as a recruiting and retention tool. So we're really interested in that space, as well as looking at non-traditional hours too, focused on healthcare employees, our Department of Transportation employees, folks that work those non-traditional hours. So those are all exciting opportunities. Okay, regulation update. If you ask me at this time next week, I think it'll be out of our hands, which is super exciting to be part of. So we presented a little bit on that to the special committee. We've sent a summary of changes documents to all of our providers in our licensing system. We've provided that as well to our Child Care Systems Improvement Team, which is called our SIT team, and other stakeholders as well. The regulation review process, it's been fun to be part of. It's been very, very interesting to try to find that kind of that foundational level for what makes a good regulation and based on what. We've done a lot of outreach for that. So like I said, with our systems improvement team, a couple different sessions with them. Internally with staff, we have staff, many of which are former child care providers. So good to get their perspective on things. And then we had a couple of engagement sessions with providers on a couple different Saturday mornings as well. One of the things, when I started in February was like, don't do these sessions on a Monday at noon. Don't do it on a Friday at 2 p.m. Your child care providers are busy working, and so offer that on a Saturday morning. So we did a 9 to noon session a couple different times. We had about 430 providers that attended, and then we made a map. We kind of visualized a map, and we had attendance from each and every corner. We even had providers that live out of state but work in state. So Missouri and Oklahoma were represented on our map as well, and that was really good to see. And then we've had a survey that's been open really since we started the regulation update back in March, where providers, general public, could go in, pick the specific regulation that we had kind of highlighted for potential revision, and then give specific feedback on that regulation. So I think we had 99 submissions on that end of things, and we felt that we really had reached a good general consensus on what we were proposing. One of the interesting things with the regulation review is it's hard to put into a one-pager. It's impossible with this regulation review because we had found about 60 regulations that we wanted to revise or completely strike. but modernize. By the way, we had some regs which have been in place since 1983 and haven't been touched. And so we're like, what is a wash basin? What is a wash? We need to update that language. So, but I think we feel really good about where we're at, and now just kind of going through that formal promulgation process. And of course, with the opportunity for public feedback, public hearing, and that sort of thing. So more news to come on that probably within the next week or two. And then upcoming, so part of the regulation review, when we engaged with our stakeholders, we heard specifically back from our school age programs and drop-in programs. Those are Boys and Girls Club, YMCA. You might have some seasonal, like summer camps, Parks and Rec programs, things stakeholders like. There are other providers that do programs in those spaces too. They actually came to us and said, this is great, but we kind of want to think bigger. And we were like, yes, us too. What do you mean think bigger? What do you mean? And so we're taking this opportunity to really do a full comprehensive review of all school age and drop-in programs. So we're holding a summit this upcoming Wednesday here in Topeka. We've invited every single one of our SAPs and DIPs, as they're called. And I will say one of their first recommendations was we don't want those titles anymore. So it's the Out of School Time Summit is what it's called. And you see that out of school time is something you'll see really nationwide concerning those programs. So we're going to take a look at all of those regulations. We're going to have DCF present on some potential subsidy opportunities for those programs as well, what that might look like. And then we're going to kind of get down to work in the afternoon. We have some different breakout groups of those stakeholders, and we've turned over the reg books to them, and we said, you know, make recommendations. And we've had two of the largest stakeholders that have sent full PDF documents to us with suggested changes, most of which, to be honest, we are on the same page. And so we've gotten very good feedback from them. Very positive feedback, and I think just kind of the start to a really strong relationship specifically with our providers. I want to transition real quick. This last update I have for you guys, I apologize, it's kind of a long one. So I oversee WIC federally, you all know, with our budget situation, which luckily we were able to get the continuing resolution, which gives us funding through November 17th, I believe. We had a couple different situations. I'd sent some memos. Some of you may have received that. One of the issues we were up against before even the budget situation was a concern was we have this thing in WIC called cash value benefit or cash value voucher, which is essentially a month-long allowance to use for fresh fruits and veggies for women, infant, and children. Those amounts had been increased through some COVID funding, COVID federal funding for the past couple of years. And that was set to expire at the end of October. And so our first initial concern was, my gosh, our CVB, as it's called, that's, you know, what do we do with it? Do we keep issuing the higher amount? Is it going back down? The guidance we got from the USDA was, we don't know if you elect to issue the higher amount and it goes down, the state will owe the difference. And we're like, that is big time. Just for 1 month, that's about $900,000 that's at stake. So that was kind of our first concern. Well, that you know, as the government shutdown sort of started looming, then our concern grew into the program as a whole and how that was set to work. Luckily, WIC is federally funded, but it's state operated. And so even if the government does shut down, would have shut down, state WIC continues to operate with the funding that we have available. We were confident that we could have, you know, continued to operate at least through the month of November, and then you know, hoping for the best from there. And we've just kind of had to maintain contact with our federal partners to get guidance from them, and again, maintaining hope that they'll get us a good budget, I guess, moving forward beyond November 17th. So that's kind of where we stand there, and I guess I'll stand for questions before Jesse goes, perhaps.
All right, thank you, Derek.
Lots of info, sorry.
Melissa?
The overall reg review, big fan, big cheerleader, and definitely appreciate, but specifically what you're doing for that that category of care, that, the out-of-school time care. Since I accepted the position I'm currently in, working with the Boys and Girls Clubs and other groups like that has been a big part of work that I've done to help coordinate and collaborate and connect to the licensing division. This is so important to improve the package of regulations that affects programs like that. And I can't tell you how appreciative I am to hear that DCF is also at the table to talk about the way the subsidy program works for that category, because they
I had two questions. One, so this time next week, hopefully, the Word document is no longer in your hands and it goes then to the Attorney General. Is that right?
That would be the, formal,
Okay.
yes.
Okay, and then after the Attorney General signs off on that, then it goes for public comment, and then we're essentially
Yeah,
done.
they'll set comment and hearings and all that is my understanding, so, yeah.
Can you speak, well, you did, you talked about there has been an iterative process through the summer months to
Yeah.
ensure public comment along the way, so the community of provider stakeholders who end up affected by this have had opportunity, invitation to weigh in, so they're not blindsided by changes, right?
Yeah, absolutely. Yeah, we did not want to do this in a silo. And quite frankly, we're not the child care provider experts ourselves. And so we wanted to engage directly with them. Like I said, we do have former providers on staff that have been very helpful, even operational improvements, but it was very purposeful to have those outreach opportunities, both with our licensing specialists, our local health departments, to hear, their opinions on things and then talk directly to the providers themselves. And it's so interesting because you might find one provider, like, ratios and capacities, how many children you can care for within your license. We would get someone that was like, give me all the kids, I can handle them all. And then somebody that's like, they want a very low ratio. And so it's like, it's trying to find that balance and then basing it off of state standards, national standards, what we need specifically in Kansas. And so at the end of the day, when we had those provider sessions and we were speaking directly to them, the comments that we got back. We had providers that were like driving to the regional public health meetings, which are specific to local health departments. Knowing that Jarvis and I were there, they were driving to meet us, and we got a couple comments, and they would like, this is really good. And so we felt really good about having like a general consensus for some of the proposed changes that we were looking at, so.
So, great. So, yeah, I think that's a good reminder that you've had input, stakeholder input throughout the process. This final step is just kind of public comment TM, like the formal thing. And then I was intrigued by I'm happy to hear the uptick in the number of licensed providers. And you mentioned closure reasons. So do you find out those reasons through like an exit interview? Is it a form that's submitted? And is it possible to see kind of regular reports of reasons? And are those standardized reasons?
Yeah, so our exit survey of sorts is not live quite yet. That's sort of the things that we're working on finalizing, standardizing some of the responses. And then we wanted to pilot it to kind of a small number. We wanted them to complete the survey and then give us feedback on it. Like, does this capture the feedback that you would want to give us, essentially, and then rolling it out larger. One of the things at KDHE, obviously, is we have the benefit of having like data analysis and epidemiologists in-house. So I usually walk down the hall and I'm like, what do you think about this survey? And they tear me to shreds, and then we start from step one. But Child Care Aware does one. They do an exit survey as it stands. I don't know, I'd have to get more info, John, on like what their response rate is and things like that. So we kind of wanted to do it in partnership with them as well.
Thanks.
Further questions? All right, thank you, Derek. We'll move on to your associate, and I'm sorry, I can't see your name card, so please introduce yourself.
Thank you, Derek. I'm Dr. Jessie Piper, the other Bureau Director for Family Health. Just to kind of orient you to what I oversee, Derek's over child care licensing and WIC, like he mentioned, but I have a more variety of programs. So all of Title V, maternal and child health, is under me. Children and families, so that includes things like Part C, infant toddler services, home visiting, our other aid to local programs, and I also have screening and surveillance, which includes newborn screening. So all of my programs are pretty across the lifespan, so I'm trying to focus on just the early childhood stuff to give you some updates on. I do have both good updates and some not so great updates today, so I'm going to start with the good. First, we received notice of continuation funding for 3 years for our Kansas Kids MAP program, which is really great. For those that don't know, that's our pediatric mental health care access program. Basically just provides support and education for primary care providers for these, 0 to 5-year-old kiddos. So really, really good stuff. Unfortunately, I feel KDHE kind of lacks in the behavioral health arena, and this is one area where we're working really hard to make some improvements, and that funding can help a lot. So that's one good thing. Another good thing is our CARE program is seeing some great increases. That's the Child Abuse Review and Evaluation Program. That's obviously not just KDHE, it's a group of state agencies working on that. They offered a new provider training in September, and we now have a total of 52 trained providers in that program. There was also some testimony provided last week for the Joint Committee on Child Welfare System Oversight. I have not yet had the chance to review the 5 hours of testimony to pick out the important pieces, but that's on my to-do list. Maybe I'll use my commute to do that. Okay, now I'll give a medium update. Our McV program just sent out some award letters last month, and for those that don't know, that's home visiting, and there were a few of those programs that received decreased funding for a multitude of different reasons. So we are working really diligently across the next couple of months with those programs to make some improvements so that we can increase their funding back to what it was. Also, programs are doing some strategic planning over the next few months. So my team is doing some site visits to help support that strategic planning. So that program recently went through a supervisor shift, and I think the new supervisor is like the sky's the limit. We're going to see some really great improvements, but we have went through a little transition period, and there's definitely some coaching happening in that arena. Lastly, I know a few of you in the room already know about this, but Part C, our infant toddler services, has experienced a really rough week. We have some issues with the vendor that supports our database for that program, and he let us know on Monday that he was shutting down the database, so very little warning. He's now extended that to next week, and just to give you kind of a high-level update on what we're doing, we're working on moving everything in-house to our IT department. Our IT department has worked countless hours this week to make that happen, coming up with plans if that's not able to happen before he shuts down the database, which might include, Excel workbooks, etc. And we're also working closely with OSEP, so the feds, to keep us in a good place as possible for all of our compliance and things like that. We're also keeping programs in the loop as much as we can through all of that process. Overall, this is definitely a tough situation, never something you want to be in the middle of, but I think my Part C team, the programs that are implementing Part C across the state, we're all very dedicated to make sure that the families don't feel the impact of this. So yeah, all we can do is just keep chugging, doing our best. So I'll stand for questions.
Okay, I'll start off. So I'm pretty disturbed that a vendor would shut down so rapidly.
Yes.
Is there a violation of a contractual obligation involved there?
No. To be frank, this vendor has, we've had issues with this vendor for about a year-ish. Overall, really difficult communication, not hearing back from him, trying to get an amendment to continue his contract. It's just been a mess. We've been working with our legal department, I'm sure many of you know, any state agency working with anything outside of your program, things can move slowly. So we've just been doing our best, and unfortunately, this is what happened. I don't think that there was anything my team could have done differently to make the outcome better.
Okay, so it sounds like you had some inkling that this would come to this point at some
No, I
point,
had
but-
no inkling that he would take the database off with a 5-day
Wow.
notice.
Wow, okay,
No inkling.
okay, thank you. Questions? Deanne?
A technical question, is this a CRM, or what type of, is it, what is the actual access?
Yeah.
And are you able to continue with the same program or the same type of database, or you're having to completely revamp into a whole new program?
Our IT department is having to stand up a brand new system that mimics his.
That's unfortunate.
Yes.
I'm sorry. I know how much work goes into that.
And the code that we were provided lacks, so that's making it even more difficult.
Do you have in your existing contract with this vendor the rights to all of the information and all the data that exists?
Yes, luckily that was all handed over on Monday, so
Okay,
we've
good.
used all of this week to get
Great.
something.
Okay. Well, good luck.
Thanks.
Sympathy.
So all is not lost. You have the data.
Yes.
You just have to rebuild a system to be able to
Yes.
access and utilize it.
Yes, as quickly as we possibly can, and make sure that it's a secure system, safe system, and make sure that in the interim, in the between, that nothing is lost. Because I have heard from programs that the database is having some issues since he gave us notice. So there's also that added stress.
All right, further questions? All right, seeing none. Is that the conclusion of your report?
It
Do you have
is.
more? Okay, well, thank you, Dr. Piper.
Dawn, for DCF, we actually were going to have Tanya Keys, the deputy secretary, but I have gotten notice that she's dealing with a health emergency with her father. So we're gonna move on. I know DCF is hard at work as a partner at the table with every one of these initiatives. So I think we've heard about the work that they're engaged in. So we can move on to Justice Wall.
All right, Justice Wall, welcome.
Thank you, Chairman. These are tough updates to follow, I always think, because our branch of government is always a little bit of a step removed from your focus, but there's overlap, but tough acts to follow, nevertheless. The primary update I have is about child support guidelines. Federal law requires every state to update their child support guidelines every 4 years, and it is a monumental undertaking. It takes about 2 years to complete that review process, and we have, fortunately, a committee of great stakeholders, the Kansas Child Support Guidelines Advisory Committee, that undertakes that review. They've completed that review, and I'm the liaison justice to that committee, and they have their proposed updates. We've voted as a court to release those to the public, and now we're seeking public input. And you can go to our website, kscourts.org, and you can find an online survey tool which allows you, and also the proposed changes, and allows you to go through and assess those changes and solicit comment, which we will then take and incorporate changes, if necessary, to those guidelines, with the goal being that they become effective January 1 of 2024. So there are some new substantive changes in those child support guidelines. There are also just general economic adjustments based on the input of the economists from Wichita State that has provided data from the last 4 years. And obviously it's an important issue for families and children across our state, so we would welcome all public feedback. And if you can help us get that word out, we'd greatly appreciate it. That's the primary update. The only other thing I would mention is that last week I was in Ann Arbor, Michigan at a Midwest Summit, and basically teams that included a couple of justices from other state courts throughout the Midwest and the upper Midwest, legislative representatives, judicial administrators, and pro bono services like Kansas Legal Services. Our team was myself, Chief Justice Lukert, our judicial administrator, and fortunately Senator Bowers was willing to come along with us as well. And the whole topic of the summit was rural justice, the shortage of attorneys in our rural parts of our states, and the impact it's having on access to justice, and the impact that also has in turn on families and the economies in the rural parts of our state. And the only takeaway I'll mention is that sometimes it's good to see and hear the problems in other states, because it's like we're not alone here, right? And it's interesting to hear how consistently at that summit we heard about the lack of housing and the lack of childcare as impediments to economic development and the recruitment of professionals in general, and specifically attorneys. And so it's also very encouraging to hear some of the funding and the programs that the cabinet is addressing to help alleviate that, because that's a little outside of our realm of expertise. Well, it's way outside our realm of expertise. But I think our rural justice initiative is going to be able to make certain recommendations, but some of those macro issues, we need the help of other experts in our state, and it's just encouraging to hear that that's happening. So those are the updates that I have from the judicial branch.
Justice Wall, we will be happy to share the link to the survey in our communications as a cabinet. Do you have a summit coming up in spring?
Yes, and I thought, well, I've mentioned that 3 times, so I didn't know if I should continue, but I will continue to mention the Child Welfare Summit. Will be April 15th and 16th of 2024, so please save that date. If any of you recall or participated in the mental health summit that we did in April of 2022, it's a similar concept, bringing all 3 branches of governments together, along with local leadership and people with lived experience in the child welfare system, coming together and trying to address the issues that we have in our current institutions and our frameworks. So yeah. Thank you for that reminder. And thanks for sharing the link.
Questions, remarks for Justice Wall? All right, seeing none. Melissa?
So, no, thank you, Justice Wall. I do want to note that we don't have a corrections designee today. I don't know where Mr. Billinger is, but I did hear from Carla Wiscombe, our Board of Regents designee. She is attending a day of meetings today that are important to our sector. It's the Board of Regents is looking at another round of the work done to adopt system-wide credits, so you can take the course at any of the Regents institutions, and it is portable and recognized across the system. So they're working on, they've done a general education package of credits, which was really exciting. I say it's important to our sector because when you are pursuing higher education credentials in child development and the type of degree programs that support child care and the array of services that serve our birth to 5 sector and their families, it can be difficult when you start at a community college and want to go to a 4-year institution and whatnot. There have been some hurdles along the way. So we applaud the Board of Regents for continuing to look at ways to take a systems-wide approach and create more and more portability of credits. So that's all I know, but wanted to share that.
All right, thank you, Melissa. I'll share with you that yesterday when I met with Melissa to prepare for this meeting, she had one concern about meeting in person as opposed to virtual. She didn't know how chatty the members of the board would be. I think we've measured up. Okay, good. All right, so that brings us to Melissa's director's update. So Melissa?
Thank you, Mr. Chair. You know, it's that world of Zoom where it's easy to stay on mute and let the meeting progress. So we are on the right timeline, and we have had robust discussion, and it's felt really good. So appreciate that. You have heard a wealth of information about the work the cabinet is engaged in, and yet there's more. So I have touched on the staffing reorganization. With Lucas's departure, we actually reduced from 7 of us to 6, but I think the realignment of the responsibilities has made us a really effective team, and I appreciate the support from everyone, including, we've got Megan Broha, who supports administrative work with our grant programs on the federal side, and then we've got Dioga down at the end. There she is, helping get a few things set up for the afternoon, but I rely on this team so much and appreciate everything every day that is involved with delivering on the work at hand. With with regard to preschool development grant, Amy gave you a good snapshot of where we are with the different funding streams. We will bring the needs assessment draft to this cabinet at our December meeting, and then we will have the strategic plan draft at the February meeting. So we will give you all a chance to read and review and understand what in terms of the needs assessment, a preview of what we're seeing, and the chance to discuss with us the two reports. We are continuing, the cabinet is the lead on a workforce registry design and build project, and we're entering kind of the final phases this fall. We are adjusting the workflow a bit because one of the partner entities, the Kansas Child Care Training Opportunities Group, or the shorthand we call CASITO, they have adopted a new, they're bringing a new professional development registration platform online, and our registry has to interface with that. So we're in the process of realignment because this will be an even better solution than where we started. So we're excited that we have some tools to support the child care workforce in the pipeline and set to start rolling out. We've had soft launch of a couple of initiatives, expanded links to quality offerings, which is right now it's work done through DCF and their child care quality improvement funding from the federal block grant program, and our early childhood career pathway for child care professionals. So both of those are soft launch, and we are working on the implementation to bring this statewide, to train providers and offer opportunities to build the awareness and understanding of how these will improve process and modernize the work that they have to do to prove that they are receiving their annual training hours and the credentials needed to further their own careers. So we're excited about those. December 11th, we will have a summit, a data summit, to unveil the new data dashboard that has been in the works through the Early Childhood Data Trust efforts. It is a stepping stone to a system that can produce unduplicated counts of children receiving services in Kansas. This is aggregate data that gives a snapshot. It's not there. We are not able to give deduplicated counts. I'm looking at Monica because I know this is the world your day job inhabits, but it is progress from where we are today because it's bringing data together to show across multiple agencies rather than just, oh, here's the population the cabinet is serving, et cetera, et cetera. So we've started to have some previews as they begin the beta testing segment of the development process, and it's exciting progress that we are looking forward to bringing to the public. I think most of you were able to join us on August 14th from the Cabinet Board at our celebration of the statewide expansion of Dolly Parton's Imagination Library. As the statewide partner, it is our job to ensure that we grow this program so that every family in the state has access to registration. And I want to note some numbers, because as fun as that day was to celebrate with Dolly, I think the work itself deserves the spotlight. When we were first named the state lead in 2021, 21% of eligible kids in the state were enrolled in the program through the patchwork of local partnerships. When we announced statewide expansion in July, we had grown to 28% of eligible kids. As of yesterday, we have 37% of eligible kids in the state enrolled. And enrollment means they are receiving in the mail on a monthly basis one free age-appropriate book. And that is for children who, from the day they're born until they celebrate their 5th birthday, they are eligible. So the program itself sends a welcome book to every child that gets registered. The first thing they receive is The Little Engine That Could. Dolly shared with us that is her favorite book, and she finds it inspirational. So that is the welcome. And then the graduation book, when they celebrate their 5th birthday that month, they get a book called Look Out Kindergarten, Here I Come. And in between, the books are chosen by Dolly's role. Her foundation supports the program through kind of high-level administrative work. They have a book selection committee made up of early literacy experts and all the right kinds of subject matter experts that you would want on a committee like that. It's an international program, so they provide baseline support. They run the fulfillment center that processes and packages the books for mail to each territorial region, and they have contracts in place with the publishing houses that it's Random House that is their publishing partner, and they get a really special cost for the books. So we as the state partner cost share with local programs, but our job as a state is to pay for the mailing, and we get a nonprofit mailing rate, and the cost of printing the books themselves for our Kansas kids. So we currently have 69,161 children in the state of Kansas are officially enrolled in the program. We want to keep that going, so I share this to the broader audience. You can go to either directly to the Imagination Library website, or you can come to kschildrenscabinet.org. We have a special link to sign up for the program, and then we applaud our local partnerships across the state for making sure this program is available. We are actively engaged in the process of drafting articles of incorporation and bylaws for a 501c3 nonprofit. I will this fall, Deanne, I'm looking at you, we will call a meeting of the Imagination Library Advisory Committee to bring a progress update to you all. It's been a little busy, so apologies, but we'll try and squeeze that in before the holidays set in. But we have received some pro bono legal assistance to get us to this point, and now we've engaged an attorney who does this work for nonprofits and is willing to cap his service fees to no more than $1,500. So we will have the appropriate package of legal documents to submit so that we can apply to become the nonprofit Imagination Library of Kansas affiliate and begin to service the program and really ramp up our private sector fundraising to support things. So that's an exciting development. We are also engaged in some planning with the folks at the K-State 105 initiative. That for the it's another new project to bring to your attention here. This spring, the legislature added funding for an initiative that K-State was seeking to foster small business development across the state. They came to us at the Children's Cabinet because in their statewide listening tour and the early planning that they had been doing, what they were hearing is that, yeah, for all the things that are very business oriented, that are necessary to help a small business startup, especially across rural communities, what communities really were speaking as their greatest needs in order to attract businesses to their communities had to do with healthcare, housing, and childcare. So they turned to us, and I readily agreed that we would walk hand in hand with this new initiative. They have the network of research and extension agencies across the state in all 105 counties. Their intention is to bring this program to 105 counties in the state, so to meet communities large and small and help bring resources to bear. What I like about the future of this partnership is the things they were asking us to provide are projects we are already doing. So the opportunity to leverage the work that is happening already and elevate it through the profile of K-State and the K-State 105 initiative, and have their support for the things we're doing, and to be able to support the vision of this initiative is a really exciting opportunity. Our friends at Child Care Aware of Kansas are part of the team that's stepping forward to facilitate this arrangement because of the work they do in the lead role for the Communities in Action and the GO team and other resource and referral activities that already exist. So the beauty of this is that without duplicating each other's effort, we can complement each other and team up and really help make sure that communities have the support and resources they need. So to my agency partners, hello, we've agreed to support a new set of initiatives. You probably would have been called on anyway. This way it's a more organized approach to the request for assistance. And so we will be updating you as warranted at future meetings on the future of that initiative. A couple of us serve on the governor's early childhood transition task force, and we will have our next meeting October 17th. We did a public listening tour in June. We've had the first meeting was agency reports to the task force about the array of programs and services we each have in our portfolio. The second meeting was hearing from other states about their governance structure and how differently they organize. So it was Colorado and Missouri, by virtue of the fact that they are our neighbors, border states, and that they have two different approaches. So we heard from both of them. The listening tour came next, and then our August meeting was really a task force discussion opportunity. So we had a report out, thanks to Jackie Counts from KU CPPR. Her team attended every session and supported the Hunt Institute with the synthesis of all of the feedback that was gathered. And so Jackie gave a report on the findings, that the things we heard at those listening sessions, and then the task force had discussion time. And there have been working groups that have each met since that August meeting on the topics of programmatic changes in terms of location. It's the movement of programs between agencies, data and metrics. How do we assess the impact of change, and the timeline and logistics of such proposed changes. So we have the meeting in 2 weeks to receive a draft report from Hunt Institute that is based on that compilation of inputs over the last 6 months. And it will be a chance for the task force to weigh in and help shape the final recommendations. And then a final meeting will be held in December to adopt a final report and move that on to the governor. For the voting members of the cabinet are sticking around for a retreat with us this afternoon, and we are excited to hear the perspective from the national perspective of why approaching this project to realign the governance of early childhood care and education system programs across the states, why nationally we see these trends emerging and the benefits that states are realizing from such change. And then we will engage in some forward-thinking discussion as a board. And then finally, I was appreciative of the opportunity to be invited to present to the Child Care Interim Committee, which is chaired by Senator Erickson, on the state of child care in Kansas. And I echo John's remarks. That was a refreshing day of committee hearing for the interim legislative committee process. I feel like I have been on both sides of that committee table, so it looked like every member of your committee had the time to ask the questions that were on their mind all day long. And I know we as agencies were given the courtesy of time to present on our initiatives, and I wish that could serve as a model for more committees. Public input in the afternoon in a 2-hour window, so I just feel like every effort was made to hear from the right universe of people interested in providing testimony. I want to invite you, if you want to offer any remarks about the committee, and I know there's another meeting, so I give you the floor.
Thank you, and I appreciate the kind words. I had the easy job. I just had to kind of facilitate. The real work was the input of the stakeholders who came. And I know John and Melissa and Derek, you guys and many, many more provided invaluable information as this committee moves forward to partner with you all in looking for solutions to the issues that we're dealing with, KSDE, so many stakeholders at the table. And I wish we would have we asked for 4 days. We could use 40 days, honestly, but we were given 2, and we're trying to make the most of that. So really, you guys did the heavy lifting, and thank you from myself and the committee. Our next meeting is November the 1st, and at that meeting, we will be looking at what other states are doing around innovative child care practices. And then the committee will roll up its sleeves and take everything that we've learned and then come up with recommendations to take back to our legislative colleagues when session starts in January. So I just want to say thank you for being patient and gracious with the process on a shortened time frame. And we really look forward to seeing the outcome and output of that committee, and hopefully continue that working relationship. So thank you.
Mr. Chair, I'm going to stop there. I too could probably take 40 days to talk about the work of the cabinet, but you have a pretty good understanding of what is occupying our days currently. The slide that's up on screen is a slate of proposed meeting dates for 2024. We like to always give our board members as much of a running start on arranging your calendars for good attendance. The proposal would be to continue with the first Friday morning of every other month at 9 a.m. if that cadence and time frame continues to work for all of you. We are happy to continue with that process. We had, in my first year in this role, we reorganized the work done throughout the year. I feel like we're in a groove with the process and the things we bring you from one meeting to the next. So, and it aligns nicely with our responsibilities to the state budget process, which is really important. So that is the slate, and I want to call out the fact that often we are busy looking for alternatives to the April meeting date because it collides with the Easter weekend and certain vacation schedules and other types of commitments that kind of fall around that season. But this year, April 5th is the week after Easter, so I feel good that we can stick with that. So that's that list, and then just reiterating that October 19th at 11:30 in the morning, we will hold a virtual meeting to bring you just the one issue, the slate of the first round of Capital Project Fund Accelerator grants. So I'll turn it back to you, Mr. Chair.
Okay, thank you, Melissa. And regarding the December 1st meeting, I don't believe the final report will be available for the Early Childhood Transition Task Force, but will we get an update at that time?
I would be delighted to bring you an update, and if possible. I'll check and see the status of the draft report to see if that's something that is available to share. That's a project I'm not in charge of, so it's beyond my control, but if we can, we will, and certainly we'll give an update. We'll put that on the agenda to make sure you're aware of.
All right, good. So committee, you see before you the proposed meeting schedule for the coming year. It follows the model that's been in place for several years. Are there any objections to any of those dates? If not, we will adopt the staff recommendation. And I believe that's it. And we were chatty enough to use up the allotted time, so thank you all for that. Yes, Deanne.
Thank you so much. I would be remiss if I just did not congratulate you and the entire team on Dolly's visit. And as the Cabinet's task force member on the committee, I'm just so pleased to see that nearly 70,000 of our youth are enrolled in this program, and I cannot wait till we can dig in and find additional financial resources, and just really am so grateful to all you did. I know it was heartfelt and a lot of work, and I'm just so grateful for you and the entire team. Thank you.
All right, well, that concludes our agenda. I just want to thank all of you, both the voting members, the ex officio members, and staff for indulging us in meeting in person one time. I think this has been very valuable. I really appreciate it personally. It's been good to connect one-on-one rather than virtually. But given the realities of our busy lives, we will resume virtual in, well, November 19th, and going forward. October 19th, yes. All right. With that, seeing no further business